Assal- Okay. So, Assalamu alaikum and a very warm welcome to everyone joining us today. And I'm Radai Fatma and I'm the associate at Education Department. So, first of all, I would like to thank all of you for being with us throughout our Match Blueprint series. Let's get started with our final episode of Match 2025 Blueprint series, Internal Medicine. Before we start with the session, I would like to introduce what DMS is. So, Dow Medicine Society, as the name suggests, deals with medicine aspect. It has always been committed to guiding and empowering students, bridging the gap between the students and our renowned seniors. We have 5 departments, each of which is committed in promoting medicine, like doing audits, creating a guide for USCE, hosting guests like Dr. Jason Ryan, BNP founder Dogen, as well as conducting campaigns in underprivileged areas. And this year, we have launched the Match Blueprint series to help aspiring physicians like yourselves navigate the complex process of matching into residency programs abroad. This session is hosted by Aksa Nasser. She could not join us because of internet issues, so I will be filling her space today. Okay, so our co-host is Amna Iqbal, which is our president, who is committed in doing excellence. We will be joined by incredibly accomplished physicians who have successfully matched and are here to share their experiences, advice, and strategies. So, yeah. So today we have 5 speakers: Dr. Anuja Rani, Dr. Fatima Siddiqui, Dr. Umair Zafar, Dr. Huda Jafar, Dr. Yumna Timsar. So without further delay, let's get started with our first guest. Okay, so I'm gonna take over, please. Amna, are you here?
Yes, I am. Hello, I'm audible.
Yes, you are.
Hello, Assalamu alaikum, everyone. My name is Amna Iqbal. I'm a final year medical student at of DMS. It's a huge honor. We are hosting our last episode of DMS Match Meet the Match, which is a webinar series. And today we'll be leading the last episode, which is internal medicine. So first of all, thank you everyone for joining. We have Dr. Huda Jafar, who is a class and graduate of 2023 Dow Medical College. She matched into Upstate Medical University in internal medicine, and it's a huge honor to host her and listen to her journey. So Dr. Huda, welcome to the show and welcome to the talk, and we are really excited to talk the details and how did you get matched. So Assalamu alaikum and welcome to it.
Alaikum Assalam. Thank you so much for having me. Am I audible?
Yes, you are audible.
All
So,
right.
Huda, before we start and talk about the nitty-gritty details about how to get matched and all the steps, let's start with a basic conversation. Huda, please change the slides while I'll be talking. So, let's start the conversation about your pre-residency journey. So, where were you born, if you can talk about it, and what was your early education looked like, and now you are packing your bag and moving to the US. So, how does it feel if you talk about that first?
I think it feels very surreal, very overwhelming, and I think everyone can
Mhm.
agree with me on this. This is something that has been in the works for very long, and now it's actually happening. I think it's a very good feeling, but at the same time, a very life-changing feeling because it is a life-changing move. So there's that. And a little bit about me, I was born here in Karachi
Mhm.
only. I did my O levels from Dow Public School. I'm not sure if most of you have heard of it or not. Then I did my A
Mhm.
levels from Nixer College. Then I came to Dow Medical College for my MPBS. And then after that, I'm just going to
Mhm.
for my residency, inshallah, in Syracuse, New York.
Inshallah, Ta'ala. Sounds very excited because I think most of us started journey from Karachi and now we are also looking
Yeah,
forward to
yeah,
go there. So
yeah.
talk about the timeline. There's no idea of a perfect timeline when we talk to the people who get matched. Everyone has their own journey and listening to them makes us realize that, oh, we can also do it. So can you please talk about, first of all, what was your timeline? Like when did you take your step one? When did you decide that, okay, US is for me and I'm gonna move to the US? And then this is how I'm planning my journey. So can you please talk about the timeline for steps initially, and then we can talk about the clinical experience later.
All right, for sure. Okay, so the first thing that I'm going to put out here is that if you feel like, you're lacking behind your peers and all your
Mhm.
friends are taking steps and you're late and you feel like, मैंने तो steps नहीं दिए हैं, सब दे
Mhm.
रहे हैं मेरे batch में, मेरे friends group में, that's okay, honestly. And even if you take steps late, that's okay as well. yes,
Mm-hmm.
it's obviously preferred. It's obviously better if you take them, right. For example, third year के बाद आपने, for example, step one दे दिया अपना, because basic
Mm-hmm.
sciences उस वक्त थोड़े ज़्यादा आपको याद होते हैं. So that helps, of course. But if you take them later as well, I don't think it's that big of an issue. And there's no point in like regretting over that. You just move ahead and start preparing for steps later then.
Mm-hmm.
So that's kind of similar to my case. In final year, when I finally decided to, go for the US pathway, before that I was not sure about the US pathway.
Mm-hmm.
But however, I had been studying for step one on and off. So I think from my third year onwards, I had started using BNB and I had started using FA for whatever I was studying in Dow for the exams. So I had
Mm-hmm.
started using all of those resources and I was just using them on and off. And then final year May, I think bilkul towards the end. So our profs were, I think, in February, March. Yeah. So
February.
I like for sure decided in November at that time. So the November before that. And then that is when I bought UWorld as well. So I started preparing for step one properly at that time.
Mm-hmm.
I started doing UWorld and then profs ke time pe I took a break again. I had done I think around 20 to 25% of UWorld, then I took a break for my profs. And then right after profs, I once again resumed my step one prep. And then I studied for a couple of months. I also started my house job at that time, which was in May 2023. So I
Mm-hmm.
started my house job at that time. Then I took my first ward. I decided to take a minor ward at first so that I
Mm-hmm.
could study with that. And then I think by the end of that ward, yeah, August 2023, that is when I took my step one. So
Okay.
my initial plan was taking step one in August 2023, then maybe taking step two in the start of 2024, and then going for my rotations in June to August or September 2024. That was my initial plan. However, things changed a little bit, and I could not take my step two in the start of 2024. So basically, what I did was at that time, one very good advice that someone gave me was to give my OET at that time. Because February ke time pe I was not very well prepared for step two and I did not want to rush the exam.
Mm-hmm.
So उस time पे I decided to take my OET. Because when you take your OET first, you start your ECFMG certification ka process. And once you start that, so if you take your step two very late also, like even at the end of August or बिल्कुल September में कि आपका deadline तक ही result आए, तो ये होता है कि आपकी ECFMG सर्टिफिकेशन जो होती है वो ज्यादा जल्दी हो जाती है उससे, बिकॉज आपका आधा प्रोसेस हो चुका होता है. ठीक है, इट्स जस्ट अ स्टेप टू थिंग दैट हैज टू बी डन. So that was a very good piece of advice that someone gave me, and I took my OET at that time. February में मैंने OET दिया, February 2024 में. फिर उसके बाद मैंने डिसाइड किया इनिशियली कि अप्रैल में मैं दे दूंगी, अप्रैल 2024 में I'll take my step 2. However, due to some personal commitments, that was not possible. And from January
Mm-hmm.
to April, May, I was looking for observerships as well. So since I was busy with that, with my house job, I did not have a lot of time, to actually prepare for step 2 properly. So, so I decided to just, go to the US. I decided to delay my exam. So I changed my region for the exam. I decided to like completely change the dates. And then I eventually ended up taking my exam after my first observership in Houston. And I took my exam on July 31st.
Okay.
So I took step 2 at that. Yeah.
Hmm.
And then uske baad, step 2 ke baad, I had 2 other rotations lined up. So I went to 2 other states for 2 other rotations. And
Mm-hmm.
then us time pe I started studying for step 3 as well. On and off थोड़ी बहुत पढ़ाई step 3 की. Side by side application ka sara kaam, you start working on your personal statement, you start working on your CV. So I was doing all of that as well. I was finalizing my program list. So I did all of that. And then after the deadline, after the ERAS deadline, once the application was submitted, because there's a lot of work that goes into that as well. So after the application was submitted, 2 weeks after that, I took my step 3. And then I just came back to Karachi. And when I came back to Karachi, I had some 3 months of house job remaining basically. So I completed my deficit for that as well. So like I tried to complete all of these things by January 2025.
Wow,
Yeah,
it's pretty hectic, like sounds pretty hectic. And what I realized that you should be flexible with your journey. Like you shared, you pushed your exam a bit. So you should be okay in doing these kind of stuff because
yeah,
there's no absolute thing, right?
for
So
sure.
let's talk about okay, this slide seems a bit overwhelming, but I think each aspect is very important to discuss. So let's talk about scores. We heavily focus on scores like, oh, you need a 260 and stuff like this. So you as an IM candidate, what's the average you see? And if you're comfortable, can you talk about what were your scores for since step one being pass fail? So what do you see step two or step three has the impact in your IM candidate CV?
All right. Because I feel like when it comes to scores, obviously the better you score, the higher you score, the better.
Mm-hmm.
However, I don't think doors close to you when you don't get a good score.
Mm-hmm.
So if you have a mediocre score, I mean, ab sab kehte hain, 230s, 240s are mediocre scores, right? And I have my step two scores in 240s. Step one मैंने pass fail के time पे दिया था.
Mm-hmm.
Step
Yeah.
three score also not amazing. You guys can check the scores on the Dowites match experience वाली sheet as well if you want to.
Okay.
I don't want to get into scores a lot, ठीक है?
Mm-hmm.
But I had pretty mediocre scores. My scores weren't the best, I would say. However, at the same time, I would like to say is that there are programs for all kinds of scores, honestly. So when it comes to finalizing your program list, when it comes to deciding your signals, that is the time you decide कि मेरे scores पे मेरी profile पे कौन सा program fit करेगा. And you reach out to residents as well, because residency explorer will tell you a different thing sometimes. They will tell you कि ये program तो 230s वालों को लेता है या 220s वालों को लेता है, when in actual that program only takes 250 plus. So you have to reach out to people in that program to get that idea. And honestly, like word of mouth से पता चलता है, if you're like if you're in touch with your seniors, तो थोड़ा बहुत आपको कुछ सालों के ट्रेंड से भी आइडिया हो जाता है. कुछ प्रोग्राम्स बहुत फेमस हैं, वो 260 बिलो आते ही नहीं है, इंटरव्यू भी नहीं देते हैं. So there's no point in applying to those programs, right? If you have a score in 240s. So this is one thing that I would say is true. But honestly, scores अगर अच्छे नहीं भी आ रहे हैं, it does not close any doors for you. You can find programs that take people of your scores. बहुत programs हैं, ऐसा नहीं कि programs कम हैं, और match नहीं होगा. If you decide strategically, if you decide your signals properly, तो इंशाल्लाह जरूर match होता है. About step three, I think if you're a visa requiring IMG and if you're going there for rotations, अगर जैसे मेरे केस में था, I knew that I could only go once and I knew that I wanted to take step three. And
Mm-hmm.
also there's this relief that comes after taking all exams. Like at this point, I know मुझे अपने residency में भी कोई exam नहीं देना, ठीक है? मुझे अपने first year of residency में at least step three नहीं देना. कि काफी programs का ये होता है that they want their residents to take step three within the first year. A lot of programs have that, not all, but a lot of programs. So in that case, like, फिर मुझे फौरन जाके वहाँ step 3 की पढ़ाई करनी पड़ती. So there's that, and I did not want to do that. I just wanted to be done with all exams at one time. And that is why I just decided to take step 3 as well. So if finances allow, if you're there, just take step 3. Step 3 also, I feel like programs को भी थोड़ा relief मिल जाता है कि हाँ, इस applicant ने step 3 दिया हुआ है. And I've heard it helps, when it comes to when they rank applicants, because obviously एक program को आपकी वो उसकी step 3 exam की fee
Yeah.
first करनी पड़ेगी and all of that, they'll have to give you a few days, to prepare for that as well. इतने ज़्यादा आपको ऑफ वैसे भी नहीं मिल सकते residency में. And if you're someone, who wants to stay at home and study for an exam, step 3 में, that is just not possible. So why not do that before, your residency starts?
Yeah, and you feel
And
more ready, I think, because you have passed your
exactly,
step three. So they're like, oh, you are
yeah,
just becoming a resident now. So
yeah.
let's talk about house job, because since you said your journey was quite different because you went to the US, you came back to Pakistan, you completed your house job. So can we discuss two aspects of this? Number one, do you recommend anyone to manage house job? And step two, side by side, or do you say it's okay to take a break, or house job doesn't make a lot difference when you are going to the US? Because there's a lot of noise out there that oh, skip the house job, just focus on US path. When some people say no, having a home experience matters a lot. So from your experience, what do you see?
Okay, so I think there are two ways to put this.
Mm-hmm.
मेरा house job का जो experience था, it was very good and I don't regret doing house job. However, if there's one thing that I could do differently was maybe जैसे मैंने अपनी 9 months की house job की, ठीक है, उसमें मैंने first 3
Mm-hmm.
months में अपना step 1 दिया था. मेरा plan था कि last 3 months में मैं step 2 दे दूंगी. However, since मेरा जो third quarter था house job का, which was the start of 2024, वो मेरा मेजर वार्ड मैंने ले लिया था, ठीक है, तो उस टाइम पे आई कुड नॉट
Okay.
स्टडी वेरी प्रॉपरली. सो मे बी व्हाट आई कुड हैव डन वाज कि मैं पहले से थोड़ा हाउस जॉब में ब्रेक ले लेती और मैं वो 6 months भी छोड़ सकती थी, ठीक है. एंड देन उस अगर मैं इस तरह करती तो आई कुड हैव टेकन माय स्टेप 2 मे बी इन अप्रैल और मई इंस्टेड ऑफ गोइंग देयर एंड टेकिंग माय एग्जाम.
Mm-hmm.
Luckily my first rotation was like it was not very hectic, so I could still study for my step 2 and take my step 2 there, but that is not always possible. ठीक है,
Yeah.
तो आई फील लाइक दिस इज अ वे ऑफ गोइंग अबाउट इट एज वेल. लेकिन बाकी जो मैंने एक्चुअली किया वो भी कर सकते हैं. उसमें बस ये है आपका रिस्क, मैंने किया था 9 months मैंने हाउस जॉब की, देन लास्ट 3 months मैंने ब्रेक ले लिया. प्लान था उन 3 months में देने का स्टेप 2, लेकिन वो
Mm-hmm.
पॉसिबल नहीं हुआ, विच इज वाई आई हैड टू गो टू यूएस एंड देन टेक माई स्टेप. सो इफ यू फील लाइक वट एवर वर्क्स बेस्ट फॉर यू, थोड़ा बहुत क्लिनिकल गैप अगर हाउस जॉब में बीच में आ जाता है, आई डोंट थिंक इट मैटर्स अ लॉट. And also you have to be focused on what you want at that time. If like US अगर आपको जाना है तो house job का experience is not going to count as such. I mean, yes, you are going to have some incidents or some like stories जो आप house job की बता सकते हो, कोई आपने ऐसे cases देखे हो and all of that. लेकिन that's not game changing, I would say. You can have all those experiences in your observerships as well. तो आई डोंट थिंक उस बेसिस पे सिर्फ हाउस जॉब करना चाहिए. मुझे पर्सनली ये था कि आई फेल्ट लाइक आई वांट सम एक्सपीरियंस एक्चुअली एक्चुअली वर्क एज अ डॉक्टर. मुझे थोड़ा सा कॉन्फिडेंस चाहिए, थोड़ा एक्सपीरियंस चाहिए बिफोर एक्चुअली गोइंग टू द यूएस. एंड आई थिंक दैट इज वेयर हाउस जॉब वर्क द बेस्ट. And alhamdulillah, everything worked out for me. But like I said, your observerships can be very hectic as well. And it
Yeah.
might not be possible for you to study there. So it depends from, rotation to rotation. मैं जब जा रही थी मुझे नहीं पता था मेरी rotation कैसी होगी and if I will be able to study for step 2. But honestly, I did not have a choice at that time. So I had to take this step and I had to take my step 2 there. So I would say, I mean, अगर हो रहा है मैनेज तो कर लो, नहीं हो रहा है मैनेज तो डोंट फोकस ऑन कि मुझे चाहिए हाउस जॉब, मुझे कंप्लीट करनी है अपनी. You can always take a break and then complete your house job later when you come back. That will be unpaid deficit, but I mean, if you want a license of here as well, then you can complete it later.
Sorry, that makes sense a lot. So let's talk about the research and publications. Since the past few years, we see a trend that here you need 15 publications, 10 publications. So let's put it into a way that what do you see research for an IM candidate matters? If yes, so how much? Because we see the hierarchy also. There are some research which are meta-analysis, CDC wonder analysis, and some are basic research like LTE, short communication. So is that about the number of publications or the quality of publications that a person is going to portray and talk in the interview?
Yes, regarding research, what I would say is I personally do not have a lot of experience in research as well. I had like 5 articles at the time of publication, and two of them, apart from that, were under submission at that time. So I would say once again, research का भी ये होता है कि कुछ programs बहुत research heavy होते हैं. They are more research oriented, and these are the things that you find out when you actually get in touch with the residents. ये चीजें आपको रेजिडेंसी एक्सप्लोर पता नहीं चलेंगी, आपको इरास के थ्रू पता नहीं चलेंगी, उनकी वेबसाइट के थ्रू पता नहीं चलेंगी. ये आपके उनके रेजिडेंट से बात करके पता चलेंगी. So if you feel like you don't have a lot of research, मतलब 5-6 articles is a very like ऐसी profile है research की is not an excellent profile, I would say, but it's something that's having something is better than nothing, right? So मेरे पास ये था basically I had one LT, I had one meta analysis, I had one cross sectional. It was kind of like that, one review article. इस तरह था मेरे सारी publications. तो I feel like हर चीज थी but वो कम कम amount. तो बट आई न्यू कि सिंस रिसर्च प्रोफाइल बहुत मीडियोकर है, आई डिड नॉट वांट टू टारगेट वेरी बिग प्रोग्राम जहां मुझे पता है कि रिसर्च बहुत ज्यादा अप्रिशिएट की जाती है. तो आई फील लाइक इट कम्स टू दैट अगेन, सिग्नलिंग स्ट्रेटेजिकली. इफ यू फील लाइक एक प्रोग्राम बहुत रिसर्च ओरिएंटेड है तो ऑब्वियसली दैट वोंट फिट योर प्रोफाइल एंड दैट इज वेयर यू शुड नॉट सिग्नल आइडियली. So that is what I would say. It's not like अगर research नहीं है तो match नहीं होगा, ऐसे नहीं होता. There are people who don't have any research and they're still matched. So it depends, I guess, from program to program.
Yeah, that makes sense. I think we remember working together on a research project also. It's about
Yeah,
the
yeah,
breast cancer awareness. It
yeah,
was our first project to work with you. So it was our
yeah.
first publication also. So time
Oh,
flies. So,
yeah.
अच्छा, एक और चीज़, I really want to talk about the research that you worked on, like breast cancer awareness campaign. So your research profile is very diverse too. You talked about public health also, if I'm not wrong, and some of them you talked about gynae stuff. So when you were talking and doing and applying in the internal medicine, so how does it come across? Does it come across like you were very diverse and then you funnel it down, or you just portray in a way that hey, I was just exploring and this is why I was doing research in every area?
I think you can portray it that way, as you mentioned, like you want to explore because before residency, सब explore कर रहे होते हैं. I mean, yes, if you know कि मुझे for example आगे जाके बहुत से लोगों को होता है, उनको आगे जाके कार्डियोलॉजी करना है, कोई और फील्ड करनी है, ठीक
Hmm.
है. So they're more invested in that. They want to do more research regarding that. Residency, लेकिन जो count ज्यादा होती है आपकी research, of course, वो residency वाली research होती है, right? When you
Hmm.
move on to fellowship. तो अगर पहले से है, obviously that's very good. लेकिन अगर नहीं भी है तो I mean आप बाद में भी कर सकते हो वो चीज. And you can always mention if someone asks you this, you wanted to explore at this time, which is true. All of us we're not very sure, हमें आगे जाके क्या करना है future में. So you eventually figure it out by doing research, by doing these rotations. So I think that's okay.
Thank you so much, Dr. Huda, for sharing your whole journey and breaking it down for us. The last slide is about the unique experiences. It's a long journey. You start med school as like a teenage girl in 18 years, and then now going to the US. In this whole journey, do you want to share any personal professional experience that you shared and then you be like, oh, this is something I would love to mention and share with all of the audience here?
So one thing I would say is a very good experience of mine has been with the people there in the US. So
Hmm.
when I was looking for accommodation in Oklahoma and in New York, Buffalo, New York. So at that time, I got in touch with really wonderful people. You know, they were from Dow, in fact, Dow alumni. And I got in touch with them. One of them was from BDS, actually. She was a Dow alumnus, but she had done BDS from Dow. And I just randomly got in touch with her, and she hosted me at her place. And I think that was just overall a wonderful experience. And I feel like if there's one thing that I've learned is, to always give back. So
Hmm.
I just hope, one day I'm at that position that I can give back as well. I just feel like, when you're at this position, try to give back as much as possible.
Hmm.
And I think you'll just be rewarded for it. That is all I would want
True.
to say in my experiences. And do not hesitate to reach out to Dow alumni for help or anyone else for help. You can always post about your rotations, about finding accommodation on Upnow IPC groups or other groups that you find on Facebook. And you never know where you find someone. So don't
Yeah.
hesitate to ask for help anytime.
Yeah, it's like building opportunities and knocking the door. You never know
Yeah,
how much and how many experiences are waiting for you. So thank you
yeah.
so much, Dr. Huda, for talking to us. And it was very insightful to hear your journey. And we hope so, inshallah ta'ala, that we can connect later on in the Q&A session with you again. Until then, thank you so much, Dr. Huda.
No problem. Thank you.
Thank you. So now we will be taking our next speaker. Can you please change the slide? We have Dr. Anuja Rani. Dr. Anuja is a graduate of class of 2023 and she also matched into internal medicine and her hospital name is Mercy Hospital Louise. So Dr. Anuja, are you there?
Yeah, hi.
Hello.
Am I
Am I
audible?
pronouncing, yeah, you are audible. Am I pronouncing your name correctly? It's Dr. Anuja, right?
Yes.
Yeah.
Yes, it's
Oh. So, Dr. Anuja, it's a true honor to host you and talk to you and hear about your journey. So, without any further delays, firstly, we are talking about the pre-residency journey. So, can you please also tell us from where were you born, what was your early life look like, and then we're gonna talk about the heavy topics.
all right. So, first of all, thank you so much for having me here today. And I'm really grateful for being in a place where I can share my journey and getting matched this year. So I was born in a small village in Pakistan, but at a very young age, I moved to Karachi. I was probably, I think, 1 year. So I wouldn't say that I've spent a lot of time there, but I used to visit the village really often in my during my vacations. And I did my schooling. I did my O levels from city school in Karachi. Then I did my A levels from the licensed school, and then I came to Dow for my MBBS. And I would say that I have a lot of family in the US. So when I entered medical school, I knew that I want to go there, but it was not until I remember the end of second year, not until that when I was sure that, oh yes, I want to do this. And I had also started building my CV early on. Like I think I remember I started my first research at the end of first year of my medical
Mm-hmm.
school because I wanted to build my CV accordingly. And I think I started using FA and BNB, as Huda mentioned. I think she also started in third year. That's what I did. And
Mm-hmm.
so during COVID, I would study on and off. And then I think at the start of my final year, I took my step one. And at that time, because of COVID, the whole year got delayed. So our fourth year ended in April 2022, I think. And then I took my exam in August 2022. So like almost
All right.
start to mid year. And then there was a conscious choice that I made that I want to not just prep for steps, but I also wanted to focus on my final year. And also because we had given a lot of time to COVID, and even before that I was studying, so I decided to take it slow. And then I completed my final year in, I think, April 2023, after which I had two options. That I had 4 months until the cycle that year, which was September. So I gave myself a month and I tried that if I could study for step two in that time and see if I can do well. But then I thought it was too much of pressure and I wanted to apply with, complete CV. So then I decided that I'll take it slow, and I started my house job in May 2023. I just did 3 months of house job, and that's another decision that I took at that time, that I wanted to solely focus on step two. So I think after August, I took
Mm-hmm.
6 months or so, and then took my step two. So that was in Feb 2024, after
Okay.
which I went for my observerships. I think I left at the end of March. So my timeline was, I would say, more like thought out. Like I knew when I wanted
Mm-hmm.
to do what,
Mm-hmm.
but that's solely based on the kind of a person I am. Like for me, cram karna is not that easy. I can't just be
Mm-hmm.
like, one thing after the other. I need time for everything. So I
Mm-hmm.
went there, and I think I was there for around 4.5 months, where I did
Mm-hmm.
my four inpatient rotations, out of which three were in IM, one was in ID. And then at the end, I took my step three. And I think 2 days after my step three, I came back to Pakistan. So I came back in
Wow.
August, at the end of August
Mm-hmm.
2024. Then I had almost a month to like prepare for my whole match application. But I had started early on when I was in US. I was doing observerships. I was studying for step three. I would write my PS, reach out to seniors. As Huda mentioned, that having a program list is important. And I also did not have scores in 260s. My step three score was also okay. It was average. So I knew that I would not go for very high end programs.
Mm-hmm.
So that's how I started working on. Then and then yes, I did not complete my house job because I felt that then I came back and I was working at another place here. I left last month only, but I did not complete my house job because I just thought that now there's no point in doing so. And I was like, yeah, so I would say it was like that.
Yeah.
So
Yeah,
this has
thank you
been
so
my
much,
journey.
Dr. Anuja, for sharing the whole journey. I think I just have to ask one question because when we talk about step three, you need to have degree, right? So can you please talk about when like Dow University issues the degree? Because what I know, they used to issue it in July, and then in September we can go and start the RAS application and submission. So like, do you go and ask them to like give you CV, give you the degree a year, like a month before, something like that? How it looks like? Because if you're deciding your timeline and if you're getting your degree in July, so when you're going to decide and sit in the match the same year?
So I remember I got my degree in June 2023, second week of
Okay.
June 2023.
Okay.
So after that, I think you do have enough time to apply for
Hmm.
the cycle. Like this year's, I think
Okay.
deadline is September 2020, 23rd September for this year, I
Hmm.
think. So you do
Yeah.
have enough time till then. You just have to get all the
Okay.
documentation, and I think you have to get some credential verification done, which Shahab
Hmm.
Bhai does. You have to reach out to him. So
Okay.
yeah.
Yeah. So let's talk about the other aspect, which is okay. So in this, we are going to talk about the interview skills, personal statement, and hobbies. Let's break it down step by step. First, let's talk about the interview skills. So first of all, can you please share like how many interviews did you get, if you're comfortable talking about it, and then we can talk about the skills required to set a good interview.
Sure. So I just applied to internal medicine. I did not
Mm-hmm.
double apply, and
Okay.
I got 9 interviews, out of which
Mm-hmm.
one was pre-match program, and the rest were the normal ones. And I think I had two from the newer programs. So for me, the cycle was very different from how I had expected it to be. Like I remember till the end of December, I did not have many interviews, and I was not even sure if I'll match or not. Like nobody's sure, obviously, but I was more sure of not getting matched because of the number of interviews I had.
Mm-hmm.
But the number increased Jan onwards. Like I think I
Okay.
had probably four till the end of December, from what I recall, and after that I had more. And talking about these skills, I feel so. I started giving my mock interviews very early
Mm-hmm.
on. Like I remember once I submitted the application I started in the mid of October, and this is the advice that I got from one of her seniors, who has been a great mentor throughout. And she told me that you should start early on. So I would practice with myself in the mirror. There's this whole list of questions that you can practice, but it does not have to, like when you're in the interview, it does not have to look like that you have rehearsed it or rote learned it
Mm-hmm.
throughout. So it has to be
A
also
natural thing.
spontaneous.
Yeah.
Yeah, definitely. So
Mm.
for that, you don't have to learn it. You just need to practice the eye contact, the content of your answers. Let's say, like, there's this one basic question: tell me about yourself. So though I was not asked that question in, I would say probably I was just asked in 3 interviews, and everybody had told me that you'll be asked that more often, but that was not the case. So, but that question prepared me for the rest of the questions. So, like, what to say is important, but you can definitely be more spontaneous, more natural looking. So this is one thing. So those mock interviews just helped me with my eye contact. Like initially, I would not look in the camera that much. I had to practice. Like, it's hard to smile when you're talking. Not everybody can do that. So you have to learn that, because smiling and giving that positive energy is important. And then I would do some with my colleagues, like I would Zoom call them, do in the mirror. And then after like some time, I think 2 weeks before my first interview, I took my first interview, match interview. I gave my mock interview to this one senior who was very
Okay.
helpful. Like they told me what was right, what was wrong, and then I started working on that. So this is one
Mm-hmm.
thing, and it's important to be professional, honest, and humble. Like they know when you're lying, so there's no need to lie. You have to be
Mm-hmm.
yourself, but definitely like not self as in you have to talk about your strengths and
Mm-hmm.
weaknesses also, in a way that it does not show too much of your weakness. I know it sounds weird to hear that, like,
Mm-hmm.
we have to talk about the weakness, but we can't show it them fully. So you have to think about it, how to talk.
Okay.
And apart from that, I feel it most of my interviews were conversations, apart from one where they asked a lot of ethical questions, and that
Can
was
you please
new,
give an
but that was a
example? Can you please give an example, like what
so
kind of ethical question was that?
there was this one question. It was related to polypharmacy. So they
Mm-hmm.
just framed the question. I cannot exactly recall the question right now,
Mm,
but
it's
they
okay.
framed the question in a way that there's this patient who had whose blood pressure dropped and
Mm-hmm.
overnight dropped. So the resident who gave the over told the other resident that the blood pressure has dropped, but they could not figure out something like that. So what will you do? But turns out it was just about polypharmacy. So,
Interesting.
multiple questions like that.
Yeah.
And they're just testing how calm are you when
Mm.
ask the question, and not
Mm-hmm.
exactly how correct are you.
Makes
So
sense.
that was, I think, I had the interview with 3 different people, and it was 15 minutes each, and it was full of scenarios. So that was one
Okay.
different experience. Yeah, but the
It's like
others were
knowing
like
yourself. It's like knowing yourself outside your CV. Like who are you as a person, right?
others were like this. In other interviews, it was a lot about the personal statement,
Mm-hmm.
CV, and hobbies. So I think it was mostly that. And there were also some interviews where
Mm.
they were going to interview me for 15 minutes, but they would end in just
Okay.
10 minutes. But that was so, like, there's no set time. And then one
There's
important thing,
okay.
yeah,
Yeah, so it makes
go on.
sense that there's no set standard on it. You just have to sit and be yourself, and you don't know what is coming from their end, right?
Yeah, I could not
Hello,
hear you properly, Anna. Yeah.
am I okay? I think, am I audible? So let's talk about the second part, which is the personal statement. So I think personal statement is that thing which in which you write your story, if I'm not wrong. So you have to talk about what can anyone else hello? Can the
Yeah.
participants please mute themselves? Thank you so much. So let's talk about the personal statement. And can you please share the glimpse that how did you write your personal statement? Like not the full version, but like an overview.
Sure. So, personal statement, I realized why it's called personal statement because it is personal to you, it is your story, and you have to try that it shows who you are. And initially, when I started writing, I was a bit stuck as to कोई format है नहीं है, but there is no set format, but there is definitely a structure that you should follow in order so that आपकी सारी story comes together. And for the reader it's easy to understand what kind of a person you are. It could be like my for my story, so my passion for medicine is a lot driven by this one event in my life. And initially I was skeptical if I should mention that or not, but then I did. It's a sad thing, but it is not but I made sure that it did not look like a soap story, that they're just like I'm just they feel pity for me,
Mm-hmm.
but rather it was something empowering. So but it took time. So for that I started writing my PS early on. I think some people said April, but I was not able to start in April, so I think it was probably June. But my first draft was done by end of July, I think. And then
Okay.
first draft was like just everything that's there, whatever I wanted to be, and it was really long, so I took time for me to cut it short. And then got it reviewed from one of our seniors.
Mm-hmm.
And apart from the story, I also mentioned the experiences that I had during my medical school. I think two of the experiences, and one was in COVID. But to specify, it is also important to realize that आप अपनी CV की सारी चीजें PS में नहीं लिख रहे हैं. Like it does not have to be the same. It's
Mm-hmm.
important that it's distinct.
Yeah.
So two of those experiences were actually talked up in, I think, four of my interviews, which was very surprising because I just put it in because it was close to me, but they would
Mm-hmm.
ask questions about it and more. And then I also tied in my observership experience because it's important to tell about your experience here, the experience you had in the US. And there was one more thing which I'm forgetting. Yes, if you're applying for internal medicine, important to bring in why this particular field. Medicine is there, but also why internal medicine. They
Yeah.
do ask that. And for the programs that I signaled, I personalized my last paragraph. And for the programs that had mentioned on their website that you have to, we want a personalized statement, I changed the names at the end of in those paragraphs and specialized those. So I think I had around
Mm-hmm.
22 statements, all like same, similar, but the last paragraph was edited. So I feel that that also worked
Okay.
for me a bit. And yeah, so it's just your story, and it does not mean that you have to get it reviewed by 10 seniors, 10 mentors. It could be just three, but the ones who gave you an honest feedback. I would be
Hmm.
more than happy with
Yeah.
that because a lot of seniors did help me as well. And I think that's how I got it right. But it took a lot of attempts. So I think that is about the PS. I hope I'm not
Hmm. So
missing.
like opening yourself for a constructive feedback is also very
Yes,
important, and then portray it and tell it down that if there's something room of betterment, so do it right. You will recommend it.
definitely.
So lastly, we will just
Definitely.
quickly wrap up with the unique experiences in this whole journey. Any moment or anything that you want to share with us that you are still stuck with it and you'd be like, this is very unique in my journey, and if you want to share with all of us.
Mm, I would not say unique experience, but I would say that this whole journey is really, and it is an exhausting process. So sometimes you would want to give up, but then those are the times sometimes you have to push through. And that's what happened a lot with me. That there were times I was like, "ये कब खत्म होगा?" But
Mm-hmm.
then I had to push through. But you also need to
Mm-hmm.
know when to take a break. And I think it's also important to have one or two people, like your go-to people who you could talk to when you feel overwhelmed, one or two seniors or mentors who can guide you through the journey, because that helped me a lot. And also, my US experience was amazing. As Huda
Mm-hmm.
mentioned, I found some really good people, and it was really I would not say surprising, but also a bit enlightening because I had heard mixed reviews. So
Mm-hmm.
Now alumni have been really helpful. So I think this is all about my
Yeah.
experience.
Yeah, it was wonderful to hear you, Dr. Anuja, because your journey wasn't just, practical, it was inspiring also. Like you talked about, you was born in a small village and then you were in Karachi and now going to the US. So we wish you best of luck in your journey and hope so we'll reconnect with you in the Q&A session, inshallah. Thank you so much.
Thank you.
So now we'll go to our third speaker. And can we please change the slide? Hello. So we have Dr. Yumna. So Dr. Yumna, are you there?
Yeah, I'm here. Assalamu alaikum.
Hello, Assalamu alaikum, Dr. Yumna. So Dr. Yumna is a graduate of Dow Medical College. She graduated from 2023 and she majored in internal medicine also. So Dr. Yumna, it's a huge honor for DMS to host you and now learn from your journey that how you made your journey till the US. So without any further delays, we were talking to all the speakers and initially we are trying to talk about their initial journey. So can you talk about the pre-residency journey a bit? Where were you born, what your early life looks like, and then we'll talk about the other details of the ERAS application and stuff. So can you please take us through your journey till the US?
Hi, can you guys hear me? Hi, can you guys hear me?
Hello.
Okay.
Yes,
Yes,
we
we
can hear
can.
you.
Okay, thank you guys. Okay, so hi guys, Assalamu alaikum. My name is Yumna. I finished medical school in 2023 at Dow. So thank you for having me here today. It's a bit about my journey. I started off very early. And like Anuja mentioned, like I always wanted to go to the US because one of my khalas is a family physician in Minnesota. And so I kind of grew up with her because she was my youngest khala. And so I always saw her doing all of those things. So I knew that I always wanted to go there. And so I think like when I started off with Dow, I knew that I wanted to go to the US. तो शुरू से ही मैंने जो है वो like I had my FA in second year I think, and then towards in the second year I would always do pathoma because I knew कि pathoma में क्या होता है, like it's there for like it's like one of the important things for steps. When I started off with third year I got Anki, and then I had like a 500-day streak on Anki. I took my step one
Mm-hmm.
middle of fourth year, so our fourth year was starting off in April. I took my step one in October. उसमें मुझे याद है मेरे बैच से बहुत कम लोगों ने स्टेप वन लिया हुआ था. So I took my step one in
Mm-hmm.
fourth year. Then in final year, summers of final year, so like June and July, I went for a rotation to Titus Regional Medical Center, which was through the school. Then I got back and I didn't have enough time to study for CK. I wanted to take my CK before I finished medical school because personally, even now, I feel like the best time to finish your steps and take your steps and plan it out strategically is during medical school. It's because of various reasons.
Okay.
Number one being you're still in touch with medical education. B, you have a routine, like you're getting up every day, you're going, you have like a full
Mm-hmm.
library access. Third, you don't have any like responsibility because once you graduate and you start working, then you have those responsibilities like आपका मतलब काम है या जो भी है. And if you're not working, then you don't have a routine because you're just at home the whole day. So you're not getting out of the house. So I feel like it's much easier. Like step one, studying was much easier for me, even though most of it was in COVID. But when I took the exam, like we had like school was on. So step two, so then I didn't take my
Mm-hmm.
step two. Then I got married in December. So that was also one of the reasons why
Mm-hmm.
I didn't take it earlier. Then I finished medical school and then I moved out of Pakistan. So then I took my step two in August, no, in July, and then August I went for one more
Okay.
rotation to University of Utah. Then I came back. I applied for the match. So I applied for the match right after my graduation. That was my first cycle of applying to the match. I applied for the match.
Okay.
Going in, I did not have my step three on me. I didn't have any US. I mean, I just had like 2 months of USCs. And out of my 10 experiences on ERAS, only two were clinical. The rest were like all, like volunteering experience and ACs and all of that. So going in, I knew that I was kind of very low on clinical, like on the clinical part of it.
Mm-hmm.
Um, And I didn't have very great scores. My CK was in 240s. I hadn't taken my step three. So going in, I was like, yeah, I mean, I'm betting on it. But then everybody was like, नहीं नहीं, apply करो, तुम fresh graduate हो, हो जाएगा. And like, people just hype you up. I was like, fine, like, why not just give it a try? And I was not in Pakistan also, so I was not doing anything at all. Anyway, I went into the match. I got one interview very late in October, and that was it. Then I was like, मुझे तो एक ही interview है, so I have to take my step three so I can get ranked higher. Then in a hurry, I went, like in December, I took my step
Okay.
three the same. I missed my convocation. That is the saddest part that I would want to bring up later in like unique
Oh.
experiences. I missed
So
my
did you skip
convocation.
your graduation day? Did you skip your
Yeah,
graduation day?
yeah, because it was in December. Like we have convocation in December. So I skipped it. I had to skip it, not be there for it. I took my step three, and then I ended up going unmatched. In soap, I had I think two interviews, but they were both FM, and I'm glad कि मेरा match नहीं हुआ soap में. But like it was sad. Anyways, so more people go unmatched now that I look back than we know and we feel. Even this year, like out of I don't know, like I was checking in 45% people from down matched only. And it seems like कि सबका match हो रहा है, but नहीं होता सबका match. Then I went unmatched. And then I was like, I have to do something really great for the next cycle. So then after I think April, like the same year after Eid, like within like 3 weeks, I went back to the US. And I think I was lucky and privileged to have the resources. And my khala was there. So I stayed with her for 4 or 5 months. I did way more rotations this time. I did some primary care rotations because I decided that I will dual apply this time.
Mm-hmm.
And till August, I was just there. And then I applied for the match and then ended up matching. So compared to last cycle, this cycle had 11 interviews, which is like 10 more
Wow.
than last cycle. And
So,
I know. So, so
so do you think step three was the reason in getting you more interviews than previous year?
I think one of the reasons why, because when I took my
Mm-hmm.
step three in the first cycle, it was in December, and December is too late. I got my result in January, first week of January, और उस वक्त तक
Mm-hmm.
ना सारे programs and interviews दे चुके होते हैं. तो मतलब बहुत मुश्किल है कि आपकी CV अब notice हो. Even if they have someone, they would probably have them on like their own wait list. They're not gonna
Mm-hmm.
put me because I passed step three so late. So yeah, one
Okay,
of the
makes
reasons why
sense.
could be step three because I had a low CK score, and for internal medicine, it's very important that you have step three. I had multiple people in my interviews mentioning it, okay, you've taken your step three, that's a good thing, whatever. And like Huda mentioned, I think taking step three is important. Having a full application is very important before you go
Yeah.
into the match.
So let's thank you so much, Dr. Yamna, for sharing your whole journey. So let's talk about the third aspect. So we're going to talk about the LORs, the US clinical experience, and the other experiences, which is in the ERAS application. So let's go step by step. First of all, you I think covered a bit of the clinical experience, but can you please talk about the observerships and how did you get them? Did you apply through an agency? Did you do cold emailing? Or like what is the way of getting observerships for you?
Right. So let's just do experiences first. So उसमें जब मैं mention करूँगी
Okay.
clinical, then I can just go over it. So
Okay.
for experiences CV crafting, one of the reasons why I think my match was way better this time, like I mentioned earlier, was how I crafted my CV. Last year, I only had 2 out of 10 clinical rotations. This time I put in 7 because obviously I did way
Mm-hmm.
more rotations this time.
Yeah.
So the first thing is that always remember your application on paper is like you are like made up of different things, right? So you have your scores,
Mm-hmm.
have your USCEs, then you have your LORs, then you have your research, then you have your like your volunteering work going on.
Mm-hmm.
So if you are lacking in any one of these factors that make up your application, you have to be really, really good in some other part to make up for that. And like that's how I saw it. And so I knew that my scores were very low. I mean, 240s is like it's a bad score.
Mm-hmm.
It's not a bad score, but it's a low score to get into IM. IM is very competitive now.
Mm-hmm.
And okay, like this score is not gonna like, break it for me this time, definitely. And my statistics score was also like very average. So I knew that I had to be like super good in some other areas. And so I
Mm-hmm.
really bumped up my USCs, like that part of my application, and then also my research. Because पहले मेरे पास I think 3-4 papers थे. Then one of my seniors, I got together with her. We did like a few ACG abstracts. So I really worked on those two things. So I feel like your experiences when you're putting them down, they really have to show that, like be really good for your like to make up for your average score. Right. So now in your
Yeah.
experiences and your whole CVs, I think CV में शुरू का part जो है, it's like your personal information. Then comes awards. Now, a lot of times what I did in my first cycle was that I didn't even like sell myself. I kind of undersold myself because like मुझे था कि like मतलब मैं क्या ही करूँगी. So there's a section for awards in your CV, in your ERAS CV.
Mm-hmm.
And in my first cycle, I wrote down this one line, like actually like three words: honors, CGPA 3.5 plus. That's it. Because my
Mm-hmm.
CGPA is 3.5. And so I put that down. Because I knew that, I mean, I had heard people put it down like honors, it's like 3.5 plus GPA. So like, so I was like, okay, fine, ऐसे लिखना होगा. That's all I wrote down. After going
Okay.
unmatched, when I saw other like my senior CVs, they had put down every single year की जो GPA होती है वो. And they
Oh.
had put it down like honors in year one, GPA, whatever, whatever. And I know it sounds like so lame because I mean, they will eventually check your MSP and they will know what your
Hmm.
C, what your GPA was. But I feel like बहुत सारी जगहों पे आपको अपने आप को जो है ना लाइक सेल करना आना चाहिए लाइक आपको अपना कभी कभी आपको अपने आप को ओवर सेल करना होता है and especially with like
Yeah.
gore because I don't want to be like mean but like so many of them they do like very
Hmm.
like basic stuff, but they will sell it like, oh wow, like pata nahi kya kiya hua hai. So I feel like that's the same case with your CV, and that's the
Yeah.
first thing I see. And so then I remember I put it all down, like her year ki GPA, like, and I had good GPA, so I mean I could just show it off. And it was brought up in
Hmm.
interview, in fact, okay, oh yeah, like you have a good GPA, whatever. And then I had like a best oral presenter award in one research. I put that. That was like in third year. So I put that. Then one of my CG
Mm-hmm.
apps, the presidential poster award, I put that. And also because
Hmm.
I'm very sporty and I had mentioned in my CV later कि I watched tennis and I like whatever. So I put down that I had won like gold medals in like long jump. And that was in high school. I
That's
still put it
cool.
down.
Wow. Hmm.
So I asked a couple people. They were like, like just put it down. Like, who cares? I was like, okay, fine, I'll do it. It did feel stupid. I'll say like like I'll agree.
Yeah.
Okay, I mean, you gotta
Just
do
like everything about you since you were born till the day you were
it.
sitting for the match. Just you need to
But yeah,
evaluate yourself.
to be about something that you're passionate about. Like I'm very passionate about watching sports and playing sports, and my whole CV
Hmm.
show that. So I put it down, right? So that's your awards part. Now then come your experiences. Now, I highly recommend that always have at least 5 clinical experiences. And that is because
Okay.
when they're seeing your CV, they want somebody who's a doctor, right? They don't want somebody who's a
Hmm.
volunteer at some NGO, or they don't want somebody who's
Mm-hmm.
a content writer. They don't want somebody who's like who's very good at teaching. So you're putting like a lot of teaching experiences.
Mm-hmm.
Put at least 5 experiences that are clinical. Uh, I put like 7 this time, but put at least 5,
Hmm.
right? Because it really shows how clinically oriented you are, आपका कितना experience है, आपने कितना काम किया हुआ है. And now that I'm seeing a shift, they really want people who have some experience, like not like totally fresh
Hmm.
graduates right off the bat. No, like they want people who have at least some experience, who know what they're doing. Right. So I had
Hmm.
5 clinical experiences. Now for me, I did one in Titus. That was through school. That was a good experience for me at that time because बहुत कम लोग कर रहे थे Titus. अब बहुत लोग करते हैं. But वो मेरे लिए अच्छा था because I really got to learn a lot. It was really hands-on. They
Hmm.
give you access to Epic EMR. You can talk to patients. You can work with physicians. It's like really good. And then
Okay.
I worked at University of Utah with Dr. Mani Moyuddin. He's a hematologist. Um,
Okay.
I don't really agree with the university versus community hospital versus like like smaller hospital like medical centers.
Mm-hmm.
But I do, like I've always felt working in bigger systems is always better. You learn a lot
Okay.
more. You get to know a lot about how the system works in the US in terms of being a part of a teaching team. So I worked at two
Hmm.
hospitals, University of Utah and University of Minnesota. Yeah, मतलब बहुत मजा आता है अगर आप किसी बड़ी टीम में बड़ी जगह पे काम करें. Like, is
Hmm.
this like
And going from
okay?
civil to like seeing that part, I think it's like a transition you feel.
Like it was not about like civil versus US, though I saw very early on in like Titus only. It's like even within the US, if you're working in like university hospitals versus like a smaller setup,
Mm-hmm.
like you feel difference in terms of how things are taken. And well, but like I still don't believe in it a lot. I feel like the quality of the rotation should be like really good, where you're getting like a lot of attention. where you're able to showcase your skills, and that is only possible if you have like individual attention, or like at least like two people more with you, because
Hmm.
then your preceptor can actually judge what you're doing, right? They can tell you, okay, ये
Yeah.
सही नहीं है, या ये सही है, ये बहुत अच्छा गया, या इसको improve करना है. And your LOR is then becomes more personalized, right? I mean, that is the way LORs become more personalized. Otherwise, LORs are gonna all look the same. So that's so my University of Utah rotation. I was the only person with my doctor, and it was a really nice rotation. The doctor was really good. He's a great teacher, even though most of my time with him was outpatient, because that's what specialists do. They do clinics.
Mm-hmm.
But I had a week of floor with him, and he was really nice. Like he really was hard on me, but I learned so much, and he was really happy by the end of it. So I think that's what mattered.
That what matters. Yeah. Thank
And
you
then
so much
also,
for, yeah.
oh yeah, sure.
Yeah, I think we are a
Oh,
bit short on time, so we just need to be a bit in a hurry. We have to talk about the LORs also. So when we talk about going and getting a clinical experience, people used to say we are doing all of this to get a good LOR and having a meaningful LOR. So how do you see, like Yumna, you talked about like having a good connection with the doctors in the hospital also. But do you see the doctors are going to write it for you a separate LOR? And if they do, so how do you stand from your other peer candidates for applying for the same cycle for the same specialty?
I feel like all of LORs do look the same, even if they're personalized, because हम सब
Mm-hmm.
same काम करते हैं वहाँ पे. But I feel like some doctors really go like an extra mile for you and put in that work, and that's what happens when the rotation is good, and it's like, like one person is there, or like two people are there. I feel like then you're able to showcase your skills to the doctors better, and then I think that's what really helps in getting that LOR. I mean, of course, like all of them will say आपके अच्छी history, आपके अच्छी examination skills हैं,
Yeah.
कर लेते हैं, epic EMR, you are good at patient chart reviewing. But I feel like it also comes down to the particular doctor, how much effort are they willing to put in.
Hmm. That makes sense. So last we'll be talking about the dual application, dual applying. So basically what we are seeing currently that every candidate is dual applying, and what they're doing is keeping a backup option. For example, a family medicine, internal medicine. So Dr. Yamna, can you please share, did you dual apply? And if yes, so how was your journey? And what are the do's and don'ts if anyone is thinking to apply next year as a dual applicant?
Right, so mostly people apply IMFM because FM is apparently easier to
Mm-hmm.
get in. I had 4 FM interviews, and only one of them was from a signal program. I was role applying because I did primary care for 8 weeks last year, and I kind of
Mm-hmm.
liked it. I mean, I always like hospital medicine way more. I like inpatient, but I kind of liked it. I was like, why not? I just give it a try. And like I just wanted to match at this point. So I was like, just go ahead and apply. I got interviews. I felt way better with the family medicine programs. Like they wanted to get
Mm-hmm.
to know me as a person, as opposed to IM programs. Everything was like cutthroat, inquisitive. They were like very like, down, like to just like ask
Mm-hmm.
me questions. But FM programs were like much more personalized interviews. I really enjoyed interviewing with them. But since
Mm-hmm.
I knew personally I would enjoy inpatient more, I ranked them lower on my list.
Okay.
But I enjoyed it more. I feel like for FM, the main thing is having LORs from FM physicians,
Mm-hmm.
because they can see कि आप उनका ऐसे backup apply कर रहे हैं. Like even they know they're not stupid. So I think having FM like physicians, LORs from FM physicians, having experience in primary care, knowing what primary care offers and how much dedication it needs, and you will know that once you do a primary care rotation in the US, because it's very different from what we have in
Mm-hmm.
Pakistan.
That makes sense. So, Dr. Ramya, we also are talking about the experiences. So, from your journey, like from your med school journey till sitting in the match, do you see any kind of unique experiences on a personal level and you want to share with all of us here? It could be anything which you feel like very personal to you.
Hello. Hello.
We can hear you, Yumna.
Oh, okay. I think unique experience, I mean, there were a couple, but I think it has to be about how I bounced back after going unmatched. I feel like I did things differently. I feel like, I mean, I could see why I went unmatched, but I feel like some of it was also luck. But I think it was like, like going through it again was like kind of very different. I think Umesh will talk
Mm-hmm.
about it. But I think that part was really what helped me, like helped me build some character, build some more character, I would say. Because on its own, even like the first cycle, like आप जब 3-4 साल तक काम कर रहे होते हैं इसके ऊपर, so it's like it's like really heavy.
Yeah.
Do it again was like, yeah, it taught me some like really great lessons. But I think that was something that I would
Yeah,
that
I
like
think
could.
all the experiences shapes you in one way or another, and you just
Mhm.
look back and be grateful for it. So thank you so much, Dr. Yumna, for sharing your journey with us. It's a huge honor to hear it and to learn from it. We'll be going towards our second section of this session. However, we'll be taking 2 to 3 minutes break, and then we'll be continuing it. Is that okay, Dr. Mess? Okay, we'll be taking break for 2 minutes, and then we'll continue.
I'm fine. How are you? Can you hear me?
Yeah, we can hear you. So we will have a first introduction, then we can formally begin. So Dr. Umair Zafar is a graduate of Dow Medical College, class of 2023, and he majored into internal medicine at Health Education Services in Mountain View. So Dr. Umair, first of all, congratulations for getting matched, and thank you for being here with us today.
Yeah, thank you. Thank you for having me. I'm happy to be here.
Yeah. So let's start the conversation about yourself first. And can you please share your journey, like where were you born and a little about your background and now moving to the US? So can you please talk about the pre-residency journey?
Yeah, definitely. Hello, everyone. And as Amna mentioned, my name is Mohammad Umair Zafar, and I'm a graduate from Dow Medical College from 2023. I think all of the speakers are from class of 23. So again, it's really good to be here. Thank you for Dow Medicine Society for having me. And I hopefully I'll be able to impart some knowledge, some wisdom that may help you guys in the coming cycle, if you're applying for the coming cycle or any cycle after that. So yeah, coming to the question, and so I was like everyone over here. I was born in Karachi, Pakistan, but up till the age of 4, my family shifted to Canada. So I spent around 6 years of my childhood in Canada, and where we were first in Toronto, then in Mississauga. So essentially, we stayed in the greater Toronto area, the GTA area. And after that, then we came back to Pakistan when I was around like 10 years old. And then I did my O-levels from the DA public school. And after that, I did my A-levels from Nixer College. And then I joined Dow in 2018. So,
Wow.
yeah,
Hmm.
yeah, that was.
Just like a short journey. So let's talk about the other parts, then getting into the US. In the second
Yeah.
section, we're going to talk about, can you please change the slides? Yeah, so let's talk about why you decided internal medicine. Because I think we make a call of IM because we be like, oh, it's an easy specialty, and most of the thing, a trend at Dow we see is like, okay, IM is a good to go field. However, when you see the data according to the NRMP, it's not a easy field to go into. It's very competitive. So can you talk about was there a default choice that okay, since it's an easy one, I'll give that a shot, or is there anything or any story behind it to pursue internal medicine?
Yeah, that's a great question, Amna. So there are multiple reasons as to why I chose internal medicine, and one I would say is like when I joined medical school and up till third year, when our clinical rotations haven't started yet, I was towards surgery. I was like, maybe it was because I didn't know much about surgery, and more that I was watching shows like Grey's Anatomy, and I was fascinated by that. Like you know how we are. So I was more towards surgery, but as third year began, and as I did more rotations in internal medicine and in surgery, I realized that maybe surgery is not something I could do, and maybe because you need a lot of willpower for that. You need a lot of energy and you need commitment for a surgery. And I was slightly interested, but I don't think that is not something I envision my future to be like for the rest of my life. So coming
Mhm.
to the reasons as to why I chose internal medicine, and there are multiple reasons, and I'll try to summarize it as I answer it during my interviews as well, because this is one question which is like asked in almost every interview I did for internal medicine. So, coming to that, there are multiple reasons. I would say that there are some personal reasons and some academic
Mhm.
reasons as to why I chose internal medicine. Personal reason would be that, unfortunately, during the third year of med school, my mother was diagnosed with multiple sclerosis. So,
Mhm.
because of that, I like had to take her to our general physician doctor, to our neurologist, to our rheumatologist, and urologists as well, because multiple sclerosis, like it's a disease that affects every part of your body, right? So because of that, although there was something which personally really did affect me, but I believe like having experienced that from the patient side, it really gave me an overview like of how every subspecialty, of how the internists, they work in cohesion and they work together, like uh, like they work as a team. When we would go to a neurologist, they would tell us of what we should expect from the rheumatologist. When we would go there, then we would go back to a general physician and we will come up with a treatment plan and then go from there. So this is something I really liked about that. And
Hmm.
then this was one of the personal reasons as to why I chose internal medicine, and an academic reason. So like during our third year, internal medicine was the first rotation we had, and seeing the patients coming up with a diagnosis and then like talking about the treatment and management. So basically we treat the patients from ground up. Like in surgery, you have the patient already diagnosed, you have the
Yeah.
patient, you already know the treatment management plan, you just cut him up and do that. Whereas internal medicine is something you start from the ground up. You start like you take it from square one, and then you start to go from there and you come with a treatment method. This is something which I really like. It really intrigued me, and
Hmm.
so it drew me closer to internal medicine. And another reason was that like I really like of uh, how enormous internal medicine and the options you have after internal medicine, particularly in the US. Like there are a wide variety of options of fellowships you could do. Like right now, I would say I'm
Yeah.
slightly inclined towards cardiology, but as I was working at SIUT recently, and nephrology is also something which I really started liking,
Hmm.
like dialysis and everything. So this is something which opens up after internal medicine. You have to, and not you can't do that after other residencies, like after neurology or after family medicine. I mean, you do have other options for fellowships after family medicine, but not as many as you have after internal medicine. So this is
Hmm.
something which also I really liked. Like you could do fellowships, or you could do primary care if that is something you like after internal medicine, or you could be a hospitalist. And luckily during my rotations in the US, I was able to experience all three of them. I was able to work
Hmm.
with a primary care physician, I was able to work with a hospitalist, and I was able to work with other subspecialty doctors. So I got experience of everything, and this is something which really drew me close to internal medicine. But yeah, as you mentioned, it's become really saturated now. And although internal medicine is something that we have like the most seats in internal medicine compared to surgery, compared to family medicine,
Yeah.
compared to neurology, compared to peds, but still you have so many applicants, you have so many people applying that unfortunately a lot of people still go unmatched in internal medicine. I think the statistics from last year were 48% of Pakistanis match. I'm not sure about the statistics from this year, but it's mostly like
Hmm.
50% of people matching and 50% people not matching. So yeah.
Yeah. Thank you so much for being very elaborative and sharing your personal experience behind it. I think this year's NMP data is not released yet. It
Yeah.
will be in August, if I'm not wrong. So
Yeah, I
we
think
can
so.
see and evaluate afterwards.
Yeah.
So let's talk about the timeline. So can you please walk us through your timeline as we all get very curious what a timeline looks like? Because again, we heard from Dr. Yumna, Dr. Huda, how a timeline could be very personal to person to person. So can you please share when did you start your journey? And did you plan it and did you execute in the exact dates, or did you also push the dates in a certain ways?
Okay, yeah, definitely. That's a great question, Amna. So the timeline for everyone is different, right?
Mm.
Some people like give the exams during medical school, like I did, or some people give it after house job, or some people give it in like 5 to 6 years after they graduated. So it's different for everyone. And as I try to tell my friends who haven't given their exams yet, like it's not a race. It's a marathon. Take it like that. It's not a race. Everyone if you work hard, you will eventually get to where
Mm.
you are destined to be, right? Okay, so but like answering your question, speaking about my timeline, so I think one silver lining the pandemic had, obviously it was a very bad thing, but one silver lining it had was that we had a ample time. So it came during our third year of medical school, and we were like at home. We were having online classes, even our exams were online, right? So it gave me a lot of time to study. So I started studying for step one in my third year, and I gave it in my fourth year, like a couple of months after Yumna. and Yumna really
Okay.
helped me a lot for my step one exam. Thank you for that. And then in my final year, I gave my CK exam. It was a couple of months. I gave it in November, and we had a final year exams, I think, in March. So I gave it
Yeah.
like 3 to 4 months before my final year exams.
Mm-hmm.
And then after that, as soon as my final year exams were done, since we will talk about this more in the next slides, I think, but
Yeah.
I was able to get an elective through Dow and UIC, University of Illinois,
Mm-hmm.
Chicago. So right after my final exams, we flew to Chicago, and then I did 1 month of elective over there, then a couple more months of observerships, and then came back to Pakistan. I did my house job, and as I was doing my house job, then in September the 2024 match cycle started, and
Mm-hmm.
so I applied for the 2024 match cycle, and I was doing my house job during that time. Unfortunately, I didn't match. I was only able to get one interview, and it didn't go on my way.
Yeah.
So after going unmatched, although that was a pretty hard thing, a really
Mm-hmm.
big setback, but then I just continued with my house job, and I finished my house job, and then I decided that I'll give step three, as I didn't have that. So in June, end of June, I went back to the US. I gave my
Mm-hmm.
step three exam, and then I did a couple more months of rotations, and then I applied for the match again in September. And luckily, this time I was able to match over here, able to get more interviews than last time. But during this cycle, I was also working. So after applying for the match cycle in end of September, I stayed for a couple of months in Canada. As I mentioned, I'm also a Canadian citizen, and my elder brother lives there. So for a couple of months, I stayed with him. I briefly worked as a physician assistant over there as well. But due to personal family reasons, and because my mother was missing me, so I came back to Pakistan. And then when I came back, I didn't want to sit idly at home and just give interviews. So then I started working at SIUT in the dialysis
Okay.
center over there. And I started working from January, and I worked until recently in April. I stopped working now. Going to take a bit of a vacation before residency. So
Mm.
yeah, briefly, this was my timeline. And
Yeah.
then in March, we got to know where we matched. And Alhamdulillah,
Mm.
I matched in internal medicine, although I also dual applied, like I think everyone over here.
Mm. Yeah.
So yeah.